Thank you everyone for coming. It's quite a great opportunity to follow up President Wyatt. It's kind of a big deal, right? I'm an undergrad student here, so that was quite the compliment. So today, I'm going to be discussing the LGBTQ youth and public health. So just a little bit about myself. I'm a political science major here at SUU. I'm also a bridge student for the Master's in Public Administration, so I do that for fun, right? Like I already don't have a big workload. I was born and raised in St. George, Utah, and I am the youngest out of 4 girls, and that's me right there. I put an arrow, but yeah, at one point I did have long hair, and it's okay, you can laugh. It's a joke. So here's a little bit of a timeline of my coming out. So in 2013, I was a sophomore in high school, and I came out to my father, my stepmother, my mom, my 3 older sisters, and my friends in high school and my high school itself, but I was still closeted. I didn't tell my extended family. So in 2016, I was a freshman at SUU, and I came out on Facebook to all my family members, and I was fully out to both sides of my family. And now it's 2020. I just recently got my Associate of Science at SUU, and I'm out to the world. Here I am today doing this TED Talk. So before I get started, I kind of just want to go over some terms. I think when people hear LGBTQ, they're like, well, what does all of that stand for? Well, you have lesbian, gay, bisexual, transgender, and queer. And just a side note for some of the statistics and data I'll be going over, it will be, we'll be referring to transgender as folks who are someone else whose gender identity differs from the one that they were assigned to at birth. And cisgender just means a person whose gender identity matches the gender they were assigned at birth. So for example, I'm cisgender. I identify as a woman, and I was assigned female at birth. So I just want to discuss a little bit about discrimination, especially with this particular community. It can happen on an individual basis, it can happen on a community basis, it can happen institutionally, and it can happen systematically. So on the right here, I have the Human Rights Campaign, their definition terms for some of the trials that we face. And you have homophobia, transphobia, and biphobia. Also, there's disparities that this community faces. Discrimination, mental health, housing instability, healthcare abuse, and suicide. So this summer, an amazing survey was conducted by the Trevor Project. And it was conducted with about 4,000 youth as respondents, ages 13 to 24, and this was conducted in the United States. This is the largest survey that's ever been conducted to talk about mental health for LGBTQ youth. So it's very, very relevant to my conversation today. As well as my personal philosophy in life is that data provides insight. So we're gonna go over some of the data that they found with this survey, starting with mental health. 40% of LGBTQ respondents seriously considered attempting suicide in the past 12 months. 48% of LGBTQ youth reported engaging in self-harm in the past 12 months. 46% of LGBTQ youth report that they wanted psychological or emotional counseling from a mental health professional, but they were unable to receive it in the past 12 months. Now that's an important one. I want you to remember that one if you get anything out of this. 68% of LGBTQ youth report symptoms of generalized anxiety disorder. So now I'm going to move over to abuse and discrimination. 10% of LGBTQ youth reported undergoing conversion therapy, with 78% reporting that it occurred to them when they were under 18. 1 in 3 LGBTQ youth reported that they have been physically threatened or harmed in their lifetime due to their LGBTQ identity. 29% of LGBTQ youth have experienced homelessness. They've been kicked out or they've run away. And 61% of transgender and non-binary youth report being prevented or discouraged from using the bathrooms that correspond with their gender identity. So that's more of the national level, right? And now I want to scale things down. I want to talk about Utah specifically and scale it down a little bit here. So here I have the Human Rights Campaign and their state score index. And it kind of just ranks us with the other 50 states to where we stand with LGBTQ rights, with our policies and our statewide laws. So we scored a building quality of 20 in 2019, which is pretty good. As you can see from what I've listed here, the green is stuff that we do have protections for in Utah, and X is what we don't. So there's still a lot of work to be done for this community. So this is a hard one, right? Suicide. Utah, we're the 5th highest suicide rate in the nation from ages 10 to 17. It's from the Salt Lake Tribune where I got that. And for a lot of reasons, we obviously don't have the demographics to what their identities were. Death certificates do not display that information. But I have to ask myself, youth are dying at alarming rates. And how many of them are LGBTQ youth? There's a lot of reasons to why suicide may be coming to these youth and it feels like an option, right? Maybe it's stemming from rejection, from peers, from family, from community. And another thing is a lack of resources and support. Utah also has an issue with homelessness with LGBTQ youth. According to the Outreach Resource Center in Salt Lake City, more than 50% of homeless youth they serve are LGBTQ youth. So this is happening in our own state. It's not just something you see on the news. These are real people, Utahns. So you're probably wondering, what's an ally? What does that mean? What does that mean to someone like myself who is a part of this community? And I would say that people who are not LGBTQ themselves, and typically an ally would be someone who is not LGBTQ, but they showed an enormous amount to advance the cause for LGBTQ equality. An ally can show support for their friends, their coworkers, their classmates, their neighbors, their religious folk in their community, and their family members. So how do you be an ally? Well, I would argue that it takes education, and it never really stops. Even for myself, I'm still educating myself every day when it comes to the transgender community. It takes actively listening to those folks, listening to their stories, listening to their experiences, listening to the disparity they might experience in our society. Third one is advocate. This is really a big one, right? Be a political advocate. Stand up for LGBTQ rights, even if there's not a single person in the audience who is LGBTQ. Stand up for us, even when we're not in the same room. And the fourth one is very special. It's respect. And you would think that would be obvious, but respect is certainly something that needs to occur between our peers and everyone. And I bring that up because in this next slide, it says that from this data that they did, they say transgender and non-binary youth who report having their pronouns respected, there's that word again, by all or most people in their lives attempted suicide at half the rate of those who did not have their pronouns respected. So respect equals so much to the LGBTQ community. It's literally livelihood at stake. So what can you do? So this is my personal philosophy of how I view this really intersectional, complex thing. But tolerance towards LGBTQ loved ones isn't enough. Celebration and unconditional love is the answer if we want to help bring down these suicide rates and start being there for our LGBTQ family, especially in Utah. We need to create shifts in our family and our communities from rural to urban, because LGBTQ folks, they exist not just in the big cities, they also exist in small rural Cedar City as well. And I believe that empathy connects us all. So here's what I am putting down my platform of how I feel that we can combat the disparities that are happening to our LGBTQ youth. I say we invest in social equity programs, affordable health care, and the accessibility that comes with that, mental health therapy services, reproductive health care. Donate and volunteer to LGBTQ nonprofit organizations. Include comprehensive sex education, which is inclusive to those of different sexualities so that we can prevent STDs and STIs and HIV with our youth. Promote healthy relationships and discuss contraceptives and consent. Anti-bullying programs in public school, we need to protect our LGBTQ teachers. We need to protect our GSA clubs. If you don't know what GSA means, it means Gay Straight Alliance, which is pretty much a pride and equality club, essentially, like what we have here at SUU. Another one is to platform LGBTQ voices and stories. So right now, I'm doing that. So congrats to our amazing crew for having me and a lesbian woman come speak and platform and tell my story. Being politically active, this goes back to vote as if your LGBTQ loved one's life depends on it. That's a huge thing. You gotta put your money where your mouth is. And the last one is legal protections from discrimination. It's time we add gender identity and sexual orientation to the Civil Rights Act of 1964 because there's loopholes and LGBTQ people are experiencing discrimination because of that legal loophole, and it's time we change that. Thank you so much for coming to my TED Talk, and I hope you enjoy the rest of Unity in Diversity 2020. Thank you.